know how I got dragged into it, but 10 days ago, my cousin in India had an accident and he had a big fracture on his knee and really open skin and open wound, lying on the side of the road for an hour and a half to get an ambulance. And this is a town, not in a remote village, it's in a proper town in India. And he had to stay for 4 days with all this open wound at home before he can get a COVID test and get an actual hospital bed. All right, so there's nothing, he didn't have COVID. So that made me think of what's happening. And since then, what I'm listening from my friends and family and few other groups that I'm involved with, I'm seeing that yes, COVID is doing a lot of damage directly, indirectly, but there's also a lot of group of patients who are left with some long-term damage with COVID, which means they get lung scarring and they get problem with oxygen and a lot of other things. So that's medical COVID point of view. There's also what I call non-COVID related health problems. So which means people don't have COVID problem, but for example, my cousin who didn't have COVID, but he suffered. There's a lot of people I'm sure are not getting access to hospital for heart attacks and other non-COVID conditions which are lacking care. There's a lot of people who are on regular dialysis, they might be missing those dialysis because there's no hospital bed. So what I see, the COVID is not just impacted directly, but there's a lot of indirect health effect. So thank you very much for having me. Look, I am originally a physician from India. I did my physician training back in 2005 and moved to Australia around 2006. And I also got a specialist qualification for general physician in Australia for the last 14 years. And I have also worked in intensive care for a few years as well. But currently I'm working as a specialist general physician in one of the hospitals in New South Wales and in Australia. So look, what am I doing, right? So I guess with the second wave started, I guess everyone might be having the same feeling, be it a doctor or not, that we can have two kind of approach, I can think, right? So one approach is where someone can say, look, it's a too big problem. It's not my problem. It's the government problem, X, Y, Z. And you can just stay aside, just hope and pray, prarthana, dua, whatever you want to do it, and just hope things get better. Even that's a good thing to do, to have your prayers there. But the other side of me said, well, I should do something. So 15 days ago, I started doing a few little things here and there, just helping people whatever I can on an individual level through social media and whatnot. But since then, I've been sort of dragging myself into a few other different things, like the group of doctors who are trying to help people in India. So there's a group of doctors in Sydney, Queensland, Victoria, some New Zealand, and I kind of came in contact with a few of them. And what I want to do is I want to sort of bring together people and make an effect, something we call synergistic effect. So everyone's doing, be it a doctor or anyone, they're just doing all this little thing here and there. And what I want to bring a concept is I want to make 1 + 1 11 rather than 1 + 1 2. So that's one of my efforts that I'm trying to introduce each other and sort of see if we can work together for something better. So that's one of my aim. And a lot of things I'm doing at an individual level. I'm not associated with any political organization or any sort of charity organization or any religious or any affiliation. I'm just doing a pure of my philanthropic effort on an individual level. Whatever effort I want to do, I want to stay out of money. So lots of people are organizing fund, and which is good. And I obviously donated myself, and everyone should as best as they can. But I guess everyone realizes that the problem is so huge that the way I see is that no amount of money is ever going to be enough. And speaking with some of my friends who graduated me as a doctor in India, what I feel that it's not just the problem with the money. There's a lot of other factors as well, which could be done without money. And that's what my efforts have been, to see what I can do without being too much involved with the money sort of thing. Even there are a lot of mental health issues, as we know. So for example, there's lots of anxiety going on. There's a lot of fear going on. There's a lot of what I call FOMO going on, which is fear of missing out. Let me go to hospital and get the oxygen. There's significantly a lot of impact of mental health, not just in patient and family, but also the doctors who are treating in India as well. They are feeling burdened with this. So one of the group I'm involved with, we got psychiatrists, and they are kind of helping with that sort of thing. And it's not just the health related and mental health related thing. There's a lot of socioeconomic impact. So one example I come across where there was a second year medical student who I came to know from one of my best friends who I graduated. He's a professor in that college. And this is a second year medical student in one of the small town in Gujarat who lost both her mother and father. And she's also got a brother who is in year 10. So you can see the impact of what COVID is doing. It's got a lot of socioeconomic impact as well. So that's something what I'm seeing. And then I guess coming back to your question, what I'm doing. Well, I've just been involved with a few different groups, as I said. So this one particular group of doctors is started by, the initiative is started by someone called Samir Sinha. So he's not a doctor, he's an IT specialist. He's got a company called Robonomics, and he's got experience with artificial intelligence. So great, he's just coming out to help. So this is what I keep saying to people, that we don't just need doctors and nurses. Anyone who is willing to help can come together and help. You just need to have that feeling in your mind that I want to help. And then I'm trying to find a medium or a platform where we can get all these people together and we see how we can utilize them, right? Now, people say, oh, India is a big population, we can't do anything, there's a weakness. But my approach is no. The population 1.35 billion, it's a strength for us. I'm not sure if anyone's seen a news in the cricket world, what's happening. So Justin Langer was having discussion with Michael Vaughan about how they lost this test series in Australia, right? But Michael Vaughan was saying, well, you guys lost to the third level Indian team, right? Not the top level, because a lot of them were injured. And Justin Langer shut his mouth by saying, look, India is such a huge country and there's so much talent out there. Even if you take the 10th of the best team, they're still going to be capable of beating another top team. So this is what I'm saying. There's a lot of talent out there in India, and I think the population is actually our resource. It's the best resource the country has got. We just got to find out a way where we can bring together and manage those resources. The human resources, if you know what I mean. Samir has started this Global Medics, same as lots of other doctors have started individually in Queensland, Victoria, I'm aware, but I'm part of this. What Samir has started is going through Telegram, where there are doctors in India, Australia, New Zealand, who are trying to give as much free advice, not sort of to do with the medical sort of thing, for example, to look at the severe patient or prescribing medication, but just giving education, support, that sort of thing. There's also other group of doctor. They started someone by Queensland, someone called Dr. Anshita Karmakar, who is friend of mine. She started this fundraising as well, which I can definitely send link to people. I'm waiting for to go some sort of a Zoom meeting today, organized by one of the leading doctor who is an Indian origin, but works in global health in Sydney. So I will see what that outcome of that meeting is, but that's another initiative that I'm trying to sort of get involved in. So as you can see, those are my medical effort, working with this group. But one of the things what I'm trying to do is whoever I know things doing somewhere, I'm introducing them to the others so that we can be a part of something big and works what I call synergistically, making 1 + 1 11 as opposed to 1 + 1 2. And the other things what I'm doing at an individual level is just through my social media. I'm just putting out there for my friends and family and the community of Indians in Sydney, if anyone has any question that I can help. And speaking with a couple of people, just explaining about maybe just general explanation about vaccine or mucormycosis or any sort of questions they have. 15 days ago when I started this, obviously there were a lot of people looking for help, but I must admit in the last sort of few days, I'm going out to people and there are a lot of people coming out to wanting to help. So I see there's a bit of a mismatch between people who want to help and who needs help. People who want to help don't know how to help. So for example, people who are coming, there's someone who was in marketing industry and it's like, how can I help? And I said, look, maybe at this stage we don't know how you can help, but once we go for something bigger, you might need to use your some sort of marketing skill to go write a business proposal or something, So I'm sure anyone who wants to help, there would be a way they can be helpful. For example, one of the things what I would like is there's a lot of demand for oxygen concentrator from everywhere. And I've been working on this for a long time. And unfortunately, sorry, not unfortunately, a lot of people are sending a lot of concentrator from overseas, right? Now, the thing is, it's not built in Australia. It's built in China or built in India. Sorry, built in America, right? So obviously, you're paying that extra cut to other people. My question to people is that, yes, we are building oxygen plant, and which is great. But if there's such a demand and there's a role for oxygen concentrator, why can't we start building oxygen concentrator in India? There's a lot of factories out there. There's a lot of people out there, a lot of skill out there. We just need to start something and upscale it so that the demand is met internally rather than relying on people on overseas. And as I said, I'm again not with any political party, but the approach of self-dependent is something which would be hard to sort of look in the short term, but it's something what I personally feel that why we can't do it. And in all honesty, oxygen concentrator from medical point of view, it's not a complex mechanism. It's not as complex as ventilator. It just requires some compression and needs some sort of chemical, which allows the nitrogen to be absorbed from that sort of thing and gives you oxygen. So personally speaking, I think it's a doable task. But again, I just don't know people. People can come forward. I'm willing to I already made a website, a Facebook page to it. People can come to it, or if anyone to start any initiative, I'm happy to be part of it.